This article was originally published by the 19th, an independent non-profit newsroom reporting on gender, politics, policy, and power. In the days leading up to Hurricane Irma's landfall in September 2017, Esther Louis made preparations to flee Florida with her husband and 4 children. The Category 4 hurricane was expected to hit the Florida Keys and make its way up the state, posing a risk to millions of residents. One of those residents was a client of Louis, who was 9 months pregnant and living in a home that the Miami-based doula feared was in too poor of condition to withstand the storm. As a doula, Louis was trained to provide holistic care to her client, anticipating all the factors that may affect her health. She worried about how the stress of an impending hurricane and evacuation could impact her client's pregnancy. So she offered to escort her client and her family toward Georgia, where Louis was headed and where her client had relatives. The caravan of 2 families departed together, inching their way in evacuation traffic to the Georgia border. What would have been an 8-hour drive took 24 hours. It was stressful, Louis said. Her client started to experience Braxton Hicks contractions, which can be caused by stress. At times they would switch drivers so she could provide emotional support to her client, who was worried about all that could go wrong on the drives. Sometimes people go to the worst possible outcome, but I'm like, we're going to get there, okay. We're going to work it out. Florida-based doula Esther Louis. Courtesy of Esther Louis. The experience was one of many instances in Louis' career where the worsening climate crisis had complicated a client's birthing journey. She realized that if doulas like herself had proper training on how to communicate the risks of hurricane season, flooding, and even extreme heat to their clients, they would be better prepared in the event of a disaster like Irma. They would also be filling an important information gap that could protect pregnancies, particularly for Black people who have a higher climate risk and higher maternal mortality rates. Over the past decade, a growing body of research has linked environmental threats like extreme heat and wildfire smoke to an uptick in stillbirths, premature births, and low birth weights. These factors also cause health problems for pregnant people, including an association with developing preeclampsia, a high blood pressure condition that can be deadly. More recently, studies have linked climate-related disasters with higher rates of maternal mental health issues like postpartum depression. So in 2024, after years of providing some of this training herself to doulas in the Miami-Dade area, Louis partnered with Dr. Cheryl Holder, co-founder of Florida Clinicians for Climate Action, a non-profit that seeks to teach health professionals how to incorporate climate change into their work. They won a grant that would help them develop a curriculum and training known as the Doula CVOT program to teach doulas how to assess the climate risk of their clients and help them better prepare for future climate threats. If the pilot is successful, it could serve as a blueprint for how to train doulas across the country as climate educators. A survey conducted by Louis and other advocacy groups focused on maternal health found that doulas who provide emotional and physical support to pregnant people were already seeing the everyday risks the changing climate pose to their clients' pregnancies and doing their best to help them cope. In New Orleans, doulas have shown up at emergency shelters to figure out what people need to safely feed their infants when access to sterile water needed for infant formula isn't always available or places to privately breastfeed can be hard to find. And in Philadelphia, doulas are playing an important role in educating patients on environmental exposures to contaminants like lead or air pollution. Weighed down by negative news. Our Smart Bright weekly newsletter is the uplift you've been looking for. Some doulas, like Houston-based Sierra Sankofa, had even developed disaster planning workshops aimed at pregnant people and families with young children that can help them better prepare for staying warm in the winter and cool in the summer. She's covered topics like how to know if breast milk is still safe if the power has gone out, and how to sanitize bottles with no electricity. But while many doulas are already helping their patients through climate-related disasters, the survey identified another trend. 95% of them wanted more training and resources to help pregnant people deal with environmental threats and hazards. So far, the pilot program in Florida, which has been running for almost a year, has trained 12 doulas on the impacts of climate change on pregnancy and maternal health. It follows a model developed by Holder, a collaborator on the project who similarly trained clinicians to understand climate health risks. She wanted to focus her efforts on reaching pregnant people, particularly from the marginalized populations she already works with as a doctor. Where else should we start other than with pregnant folks? That's two lives the next generation, she said. And if we can't learn lessons to save the newborn, the unborn, and the mom, how are we in society going to do anything? She knew doulas could be more effective in that work due to the close relationships they develop with their patients and the time they spend with them. They also conduct home visits and are able to understand more holistically what may be impacting a pregnant person's health. Nationally, doulas are being recognized for their additive care, with many states passing legislation in recent years to cover their services under Medicaid in order to improve birth outcomes, particularly for women of color. As part of their training with the project, the doulas work with their clients to gauge their preparedness, said Louis, who helped develop the assessment tool. They ask them questions like, do they have an heir?